guys? Welcome back to KimmyDTV, tips and tricks living your best life. In this video, I'm going to need you guys to get your popcorn, to get your tea, to get your drink. I'm going to need you guys to really sit back and relax because in this video, I'm going to tell you guys the differences in working in the home health care setting versus working in a nursing home setting. Information you can really use to change your life. So if you guys are interested in it, sit back, grab a snack, and enjoy the show, okay? Let's go. Alright guys, so since my last video, I saw that so many of you really wants to know the differences in working in a nursing home versus working in home health, and I will be making more videos on home health. So don't forget to hit the subscribe button and hit the notification bell so that you never miss a video. Don't forget to give this video a like. Don't forget that you can watch this video at increased speed because it really helps my channel when you watch this video all the way throughout. Alright guys, so let's get to it. So this is basically based off of my experience. I just completed week 3 of working as a home health care nurse, specifically pediatrics, but it's almost the same thing. Like, I know I never worked the adult, but it's almost the same thing. So I just completed 3 weeks, and for those of you guys who don't know, I've been working in a nursing home for about maybe 7 years now. No, 6+ years. I'm about to be 7 years in, like, I think October or November. Like, time has gone by so fast. So this is a great accurate comparison, I would say. The number one factor that is different between working in a nursing home and working in home health care is the stress, guys. So you know, as we get older, we can't handle stress the same way. Stress is really bad on the body. You can develop all kinds of sicknesses, all kinds of symptoms from increased amount of stress. Now I know every workplace has a lot of stress, but unless you work in a nursing home, comment down below if you feel it. Unless you work in a nursing home, you don't understand the amount of stress I'm talking about. I feel like everybody has a healthy amount of stress when it comes to work, when it comes to school, but I feel like sometimes the stress goes a little overboard, especially if you're just coming from nursing school. You know, your cortisol levels are already high, all of your stress hormones are already high, then you have to take the NCLEX, it was already high, and then you go into another job and it's already high again. Guys, you know this channel is all about taking care of you, my nurses. I need you to take care of yourself, so put that as a very important factor when you're deciding whether you want to work in a nursing home or home care. So stress is a major factor for me because honestly, as I got older, I'm not the same as when I was younger. The way I handle stress now, the way my body handles stress now is not the same way my body handled stress when I was a youngin', just coming out fresh out of nursing school. So even if you're young, old, whatever, I would say definitely take stress into consideration. So basically, in a nursing home, as we know, the stress is at an all-time high. Why nursing home your stress is at an all-time high, especially if you're in nursing school right now, you might be wondering whether you're an RN or LPN. Well, because you have 40 patients, sometimes 50, 60, 20 if you're so lucky. Even though everything basically falls on you. You are everybody to your patient. You are their social worker. You are their this, you are that. Even though there are social workers and stuff like that in the facility, the patient usually comes to you. You have to give medication to all those 40 people. It's just a lot of stress on one person. Whereas in the nursing home, there is very little to no stress. The only stress, I would say, is that if something happens, for example, if, God forbid, a trait comes out, you know, you're the only person that's there. So like you guys know, I'm going to keep it 100 with you guys. I'm going to be completely honest. You're the only person that's there, so you have to know what to do when your patient's trait comes out. You have to know what to do if their G-tube is blocked or if there's residue, who to call. Like, you have to have those problem-solving skills. You have to know what happens next because at the end of the day, lawsuits are real, and if anything happens to the patient, they look at the nurse. Just saying. As a nurse in the home health care setting, yeah, it could feel very homey and very fresh and very, yeah, I'm just going to work. But if anything goes down, you have to understand that they're looking for you. So you want to protect your license. So the stress is not really high, but the stress is high. The stress is there when it comes to that. And also, there's no real places to mess up because it's only you and the other person. So if, like I said, if anything happens to the patient, they look at you like, but you only have one person. So it directly reflects you, especially because it's only one-on-one. You can't say, oh, well, this nurse said something or this nurse. There's no pointing the finger at somebody else because it's just you. So do keep that in mind. It's on you, and it's not to make you fearful. I don't want you to be afraid. I want you to, just like Beyonce's song, step out your estimate and know that you're excellent. Rise! Know that you're excellent. Even if you just came from school, research what to do if a trait comes out, if Jesus comes out. Know what you're doing. Go to the training that they offer you and really soak up and understand what they're saying and have confidence in yourself. I'm not saying that to scare you or to block you from doing it. I'm just saying that so that you go in there knowing that it's not all dandelion and rainbows. You're still dealing with somebody else's life, and therefore a lot of things fall on you. If you are dealing with a pediatric patient, like trying to find a common ground between the nursing plan of care, MD plan of care, and what the parent wants, trying to make everybody on the same page. Sometimes the parent may have a different way of doing things, and you're like, oh no, this and that. Like trying to find that common ground. Trying to find that common ground is definitely important. Another difference, I would say, again, at the end of the shift, you sit back. If you were to count every single med that you give, no kidding, you probably gave past 100 medications because you are giving everybody medications, so you feel like a Pez dispenser. Otherwise, when you're giving your one patient, you may give 5 or 6 medications. You don't give a lot. Like, you come in, you give your morning meds, you do what you gotta do for the patient, clean them up, whatever, and then in the afternoon you give them their rest, and then you go home at the end of your 12 hours or 8 hours or however you signed up for. So the medication load is definitely different. Therefore, there is less chances of medication error on your part. That brings me another thing. Another difference is narcotics. In the nursing home, you have a bulk of narcotics to count, especially if you worked in the psych unit. Like, I remember I used to work in the psych unit. Guys, I would have 3 shelves of narcotics to count. So, and sometimes they can be so like particular, like they could look the same. It could be 0.5 milligram, 1 milligram, oxycodone, oxycontin. There could be medications that sound a lot the same. Sometimes the RX numbers are off. Sometimes nurses take different fentanyl patches from this one, that one, it gets confused. Then the Marinol gets confused. Like, a lot of stuff gets confused. And you guys basically know narcotics is your, not only your license, but your life. You know, you're messing with the DEA or the Drug Administration. You guys know the name. But narcotics are another thing. But with home care, well, with my patient I have now, they're not on any narcotics, so I don't have to worry about it. But if they did have narcotics, like, I bet you it's not like a whole bunch of narcotics to count. You just count those narcotics with the other nurse, and that's it. You don't have like a whole stack of narcotics to count. Therefore, your chances of making an error is also slim. Another thing I would say is a major difference is dealing with management. So you guys know when you're working in a nursing home, sometimes you have to deal with somebody called the state. Thank God I've always dodged the state because I've always worked in agency. So if I know it's a period of time where state is coming, I would either like not work that week or work another nursing home that I was working at that week, because I don't want to make a mistake in the state and they write my name down. I always want a clean record, especially when it comes to my nursing. So I think that's one of the reasons why I have a very clean record when it comes to nursing. I always dodge state. Not saying that I can't do the work correctly, but sometimes when somebody's over your shoulder watching you, you could accidentally make a mistake. So that's a great thing. And also, sometimes management is up your you know what. When they know state is coming, they're like, did you do this? Did you do that? Especially if your agency, like, why isn't this labeled? I'm like, well, I just came to the floor. I didn't know. And I'm agency. Well, it doesn't matter. It's your responsibility. Like, they just go crazy. And I understand that they have to pass. But nursing supervisors and managers, they really get on you if anything happened. It depends on the nurse supervisor's personality. But another thing is, sometimes there have been times, guys, and I've been really upset. I would start giving medication, like let's say I work 7 to 3 shift. I would start giving medication at 7 a.m. and at like 12 or 1 p.m. they could say, oh, you know what, we switched floors. But what about all those medications I just gave, and now I have to start back all over again? So that's annoying. Sometimes they change you at the last minute, and it gets annoying, So, and you have to pass like different med passes, so that's annoying. Like dealing with supervisors and management, it could get kind of annoying. Of course, as you go along your nursing career and you learn the politics of nurses, and you learn about different people and personalities. You learn don't outshine your master, Robert Greene, 40 Laws of Power. You learn how to work through that, but it's still annoying. And if you're somebody, you don't really like people telling you what to do in that way. I'm not talking about being egotistical, like, oh, no one can tell me what to do. But I mean, like, you guys know, like, if you guys don't like people telling you what to do in that way, that could be kind of annoying, because in nursing homes, people do tell you what to do. You have charge nurses. Sometimes charge nurses can inadvertently give you the wrong assignment. Like they can choose their friends to give them the easier load. I remember when I was working in Houston, one time I had like 16 patients and the RN only had 9, which was so not fair. And I had so much admissions to do, and I was working 6 a.m. to 6 p.m. I went home at 9:30 p.m. and then I had to drive an hour back just to do it all over again. Like, guys, I went through so much. And I couldn't say anything because of management, because of supervisor, because of politics, because of blah, 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 which made me really upset. So that's another thing. You in the home health, I've met the supervisor once. She said she comes every month. I said, listen, drop by whenever you want to. That's what I told her. I think my supervisor is really cool. I said, please drop by, because I like to speak to other nurses, because I do kind of miss a little bit of that one-on-one like communication with another nurse. But I said, drop when you want to. She was so cool. She was like, okay, this is what you gotta do, this and that. But she didn't really boss me around. She's just like, okay, well, what's going on with the patient? Is everything okay? She checked the patient. We had like a whole conversation. And that was it, It wasn't like, oh, you do this. It's not like that. She's basically like doing her rounds, because the RN is the person that opens up the case in home care, and the LPNs like carry out the plan of care. I know some places in some states the RN could do the same thing as the LPN. Because I know, even in New York, one of the nurses that was orienting with me, she's an RN, but she's doing the same exact thing I'm doing, but just for higher pay. She says she's in NP school, and because she's in NP school, she don't really want to be in a supervisorial role. That's why she's doing this, which is okay, because you have a lot of downtime, like I said before. In home care, you don't really have to worry about supervising, kissing anybody's butt. Like, there's no politics in that there. And that brings me another difference. In nursing home, you have little to zero downtime as a nurse, and a downtime does not equal break time. Sometimes even if you're lucky to have a break in nursing home, downtime meaning like it's not your break, you just have time to sit down and breathe, like like everybody else who works in every other job. Like, even the male person has downtime, even a secretary has downtime, a hairstylist have downtime, actual human downtime, time to breathe. Yeah, you actually get that in home care. You actually get the basic needs of being an employee, which is great. Like, you have downtime. In nursing home, you don't really get that. You do not really get that. So just to let you guys know. Uniform. So in a nursing home, of course, you do have your scrubs, or when I was working in SNF, I had to wear khaki pants and a blue polo shirt, because they wanted the patients to feel like they were at home. I have my feelings about that, but I digress. But in home care, you could kind of get away with wearing what you want. I saw some people come in like a dress, not like a I don't want to say thought dress, coming with not with like a skimpy dress, even though it's summertime, not like a dress like this, but like just like a regular Meghan Markle-ish or Michelle Obama-ish kind of dress. And the family was okay with it, and they wear regular clothes. I wouldn't make that a habit, because I always feel like keep it professional. Like, I always wear my scrubs. because I just want to keep it professional. I want the family to respect me, and I always have my ID badge, and I don't care if anybody else doesn't do it. I do it because I always want that line of respect between me and the family. You know, I never want it to be like, okay, I don't respect you because you don't even wear what you're supposed to, you know. So I wear my scrubs. But another thing you have to understand is that sometimes if the family is of a certain religion and they're like very, very conservative, they may ask you to tweak your scrub a bit. Like, can you wear something under your nursing scrub? Can you wear like something, you know, under reasonable environments and circumstances, of course, like as long as there's AC and stuff like that. If you're not somebody who wants that, like you're like, oh no, you're not gonna tell me what to wear just because it's your religion, not my religion. If you're not somebody like that, it's fine. You could always tell them, I want another case. But if you enjoy your case, you enjoy your patient, you should be willing to bend for that. I mean, not everybody's the same, but that's just my opinion, guys. Don't take what I say and be like, oh, Kimberly told me that I should wear whatever the family says. I'm not saying that, but I'm just saying, just keep that in mind. You're going into somebody's sanctuary, and if that's their religion, you need to respect that and understand that that's just how they are, and it's not that big of a deal. Like in life, you have to look at the bigger picture. Like, is this a good job? Yes. Do you like your patient? Do you love your patient? Yes. Is the family nice? Yes. Like, one thing. But that's just my opinion. But that's when it comes to dress. But in a nursing home, no one's gonna tell you how to dress. Really, no one's gonna say, oh, don't wear the tight clothes and this and that. Like, I've seen people, even I see their underwear under their white pants and stuff like that, nobody says anything. I've seen claws, not even just long nails, like claws, and nobody says anything in a nursing home. But in a home health, I wouldn't suggest wearing claws or whatever. Like, you see how my nails are pretty short? My nails are pretty short, and it's appropriate. Nobody has to tell me not to wear claws because I'm taking care for a patient that is very, very small, like very, very, very young. Alright, you guys get the picture. In a nursing home, if a patient has an appointment, you usually get their package together. You call EMS or whatever, the SSRI, wherever they go with, and you set them on their merry way. In home health care, you have to go with the patient to their appointment, especially if you're working the day shift as a home health, but not a night shift unless, God forbid, there's an emergency in the middle of the night. But you usually go with your patient, and sometimes their family is there. The family that I'm working with, they were there last time I had to go to an appointment with. So you're just there, you know, you just take care of your patient, and you know, that's it. That's all you gotta do. Like, we were in the car with them, we went to the appointment, and that was it. So that's another difference. You have to actually physically go with the patient. So you're very much involved with the family and the patient's life. Like, especially the patients, you're very much involved. You pretty much know everything that's coming up, doctor's appointments, surgeries, this and that. You pretty much know. Sometimes I feel like a mom when I'm taking care of my patient. Like, I legitimately feel like a mom. I'm like, oh my god, like, shout out to all you moms. Like, I had to tell my mom the other day, like, I love you. Like, thank you so much for taking care of me, because I was such a crybaby as a baby. I cried for I was one of those kids. I cried for everything. So to all you moms out there, because I felt like a mom. I was like, oh my god. I was just like, I love my patient, but I saw how much work it is to be a mom. There are still nurses that I still keep in contact with till this day. There has not been a nurse where I've actually been like friends, like, okay, let's go out, let's this, let's that, because that's just me. I don't like to mix business with personal. But you guys know that unfortunately so, but I think it's going to change, especially with social media and the rise of brand new nurses, you know, not taking note, you know. I think that nursing bullying is changing, but if you're worried about that, if you're an introverted person, you're worried about bullying in nursing, in your nursing job, maybe you got bullied in nursing school, I don't know, you don't have to worry about that when you're working as a home health care, because you literally just, the nurse that's leaving, you say, okay, how was the night, or how was the day, if you're working night shift, like, oh, the patient did good, the patient had this amount of secretions, the patient ate, the patient had a bad night, the patient this, the patient that, and then goodbye. You don't have to deal with the person anymore. So you don't have to worry about jealous people, people who don't like you, people who are there to get you as a nurse. You don't have to deal with that. Because guess what? You are working by yourself. It feels like you almost have your own business, you know? In the nursing home, there's a lot of paperwork. If somebody goes out, you have to write a progress note. Somebody comes back from going out, you have to write a progress note. If there's a medication change, you have to put in the order. You know, with the nursing homes who abuse LPNs, and so you have to put in the order when really they aren't supposed to do that, even though the LPNs have a lot of medications to do. If something happens to the patient, you gotta call the doctor, and at the same time, somebody else is calling you, and this and that. So there's a lot of paperwork involved. You have to write a report, you know, and especially if you're working in a nursing home where sometimes they divide it, like they're like, okay, there's gonna be a desk nurse and 2 medication nurses, so the paperwork is divided that way. But if there's not like that, you are stuck doing all the paperwork. Whether as in nursing in my home health position, because there's no Wi-Fi in the house, when I come from work, I just do my little notes. If you guys want to see a day in the life of the home care LPN, let me know and I will do that video. I just do my little notes and then that's it. I only do my notes for one person. So you get out on time as a home health care nurse. Like 9 times out of 10, you get out on time. As in a nursing home, your shift ends at 3. What if the nurse is 30 minutes late? Then she got to count. Then she got this. Then she got that. Like, sometimes I would work 7 to 3 and I wouldn't leave till 5. That's insane. But not the jail, though. When I worked in the jail, that didn't happen. But that's insane. So, that's a pro. In home health, you just leave, okay? Nobody is crying to come to work as a home health nurse. That if something happens, a pipe leaks, something's wrong, you could call maintenance in a nursing home. But at the home, you have to tell the family or have to tell the agency. So you have to be very proactive. You have to be a problem solver, like I said. In the nursing home, you have to interact with every single person. You got to interact with social work, physical therapists, and it's just not too bad. You know, thank God, I never had like a negative interactions with social workers or clerks or anything like that. Like, not really, not so much. But you have to interact with all of them. You have to work as a team and like saying, okay, this patient are they going to physical therapy? Did they get their meds? And like try to talk to them to figure out what's going on. But in the home health, you don't really need to talk to anybody but the family, the nursing supervisor, or maybe the doctor, and that's it. Another difference is delegating. In a nursing home, you have to delegate to CNAs what to do. Sometimes they listen to you, sometimes they don't. Honestly, CNAs make and break your shift. But in home health, you don't have to worry about that. You do your own cleaning, you do your own taking care of the patient, so you don't have to worry about what's being done and what's being not done. So if you're somebody you don't really like delegating or, you know, telling people what to do or being a boss of people in that way, it's perfect for you. The nursing home, you feel like you'll be pulled in a million gazillion different directions, and in the home care, you feel like you're pulled in one direction. And my last but not least difference, I love that for last because somebody mentioned that in my previous video, and it's true. I did get a $2 pay cut. So for the nursing home, I make $2 more. But in the home care, I make $2 less. That's the only difference. Like, sometimes, not all the time, depends on your state and everybody. Situation could be different. But home care is usually less than nursing home. But watch my video on why nurses are still broke. It's going to be up in the cards above. And you'll learn why that really doesn't matter. So watch my video is why nurses are still broke. So there are some nurses pulling 10 12s out of 7 days, doing double shifts, and they still broke. So before you're like, oh my God, but I don't want the pay cut, watch that video and you'll understand why that doesn't matter. Alright guys, so thank you guys so much for watching. I really appreciate you guys taking the time out to watch my videos. I love you guys so much. I see you guys' messages on Instagram, Facebook. If you have any questions, don't forget to reach out to me. I love you guys so much. I'll see you guys later. Bye.